Well, January is Cervical Health Awareness Month, and according to the CDC, over 13,000 people are diagnosed with cervical cancer every year, and most of the time it's preventable and treatable with early detection. Joining us now is Dr. Stephanie Sullivan. Thanks for being here.
Thanks for having me.
Well, Dr. Sullivan, who exactly is at risk for cervical cancer?
So women or anyone with a cervix is at risk for cervical cancer. The cervix is the organ between the vagina and the uterus that's typically checked during a pelvic exam or a pap test.
And what are the early warning signs?
Cervical cancer is a little bit sneaky. A lot of times there aren't any signs or symptoms when cancer is early or during the pre-cancer phase. Our hope is always to catch cancer before it develops, so to catch pre-cancer and treat it before it turns into cancer. Once a tumor develops, you can have some symptoms, which can be abnormal bleeding, bleeding between periods, bleeding after intercourse, or pelvic pain.
Is this a genetic predisposition or environmental?
This is not a genetically predisposed condition. This is environmental. It's from the HPV virus, which we are all exposed to once we're sexually active.
So that leads me to my next question. How exactly is it treated?
So cervical cancer is treated based on the stage at which it's developed. Our hope is to prevent cervical cancer. When we find precancerous cells on the cervix, we can treat it with an easier, more minor procedure in the office or the operating room. When a small tumor develops or when an early stage cancer develops, we can treat it with a hysterectomy. It will very quickly escalate to more radical surgeries as that tumor gets bigger and then is treated with combinations of things like chemotherapy and radiation if the cancer spreads.
So it sounds like it is easily detectable. You screen for it. So is it rare for cervical cancer to progress into terminal cancer?
When we catch cancer early, it is pretty rare for it to develop into terminal cancer. When we don't catch it early, it certainly can spread and progress to terminal cancer where it's hard to cure. But this is an incredibly preventable and treatable disease when we catch it early.
So how often should women be getting screenings?
Screening is going to depend on the patient's age and their prior results. It can be anything from yearly pap tests and HPV tests to testing every 3 years to testing with a pap and or HPV test every 5 years. Screening should be individualized to the patient. I would encourage all patients to talk to their healthcare providers to come up with an individualized screening plan for them.
All right, great information. Dr. Stephanie Sullivan, thank you so much for your time tonight.
Thanks for having me.